Tuberculosis remains the #1 killer disease in the country, followed by pneumonia. HIV/AIDS has moved from 6th spot to 3rd on the list of killer diseases. Stats SA CEO, that's Paditle Hoshla, says over 450,000 people died in the country last year, a decline from the 491,000 in 2012. Well, Kefilwe Masiteng is the Deputy Director General at Stats SA, and she joins us now from our Pretoria studios. Good afternoon, Kefilwe, and thank you for your time on the PM News Desk.
Good afternoon, and thank you for inviting us to the show.
Good. Well, TB has held the position of the country's #1 killer since 1997. So on the surface, it does look like we haven't been able to turn the tide on this disease in 20 years. But what do the numbers tell us, Kefilwe? Are fewer people dying of TB than, say, 5 years ago?
Yes, what is happening is that we are seeing a decline in the numbers of people that are dying from TB. For 2013, there's about 97,000 people that have died. And what we have also seen is that I think in a broader picture is that the infectious diseases, or what we call the communicable diseases, are declining. So that decline in terms of the TB and the pneumonia and the intestinal diseases is broadly declining the number of people that are dying from communicable diseases. And hence then we end up seeing that HIV is also increasing and getting to #3 in terms of the rated causes of death. But I guess also coupled with that is the improvement in the registration of deaths, where the doctors are now able to confidently write and notify that a person has died of HIV.
Okay, Kefilwe, to clarify, we know that TB, pneumonia and HIV are in the top 3 positions. But can you take us through some of the other leading causes of death in the country? Did diabetes crop up this year?
The rank up to #7 is that you have TB, that is at about 8.8%. You have pneumonia, that is at about 5.2%. 5.1% is HIV, which would be your 3rd one. The 4th one would be cerebrovascular diseases. The 5th one would be diabetes, that is at about 4.8%. Then we will have hypertensive diseases that are sitting at the 7th position with about 3.7%. #6 is the diseases that are related to the heart that are sitting at about 4.6%.
Kefilwe, what does the report reveal on child and maternal deaths? We know that 2 of the health-related figures show that South Africa has reduced under 5 child mortality from 61 per 1,000 births in 1990 to 45. But it was unlikely to meet the target of 20 by next December.
Both the infant mortality rate and the under 5 mortality rates, infant mortality rate sitting at about 35 per 1,000 live births, and the under 5 mortality sitting at about 45. What we have realized is that the target has been moving at a slower pace. Therefore, the targets for the MDGs will not be met. But what we have seen out of this information is that there is longevity, where people are now dying at a later stage, where even with the figures now we see that the highest number of people who died in terms of age were at the ages of 60 to 64. There is a reduction in the number of children who died neonatally, and the children that die before 1 year, and the children that are dying before they finish their 5th year. So on the basis of that, we see also the 61 years of the life expectancy in the country. So naturally we are moving back to a natural progression of a population that dies at later years, and starting to realize that there is better life where more people are living longer and dying when they are older.
Kefilwe Masiteng, the Deputy Director General of Stats SA. Thank you, ma'am, for your time on the PM News Desk.